Okay. Pneumonia, inflammation of the lung parenchyma. We are talking about the alveoli, the interstitial tissues, which now is going to basically cause alveolar filling with the fluids and pus, and that's going to affect again gaseous exchange. So pneumonia caused by microbial agent, one of the leading causes of death from infectious agents or infectious diseases. That's a healthy bronchial and alveoli. And this is one that has now pneumonia, just like what we had in the morning. And you can see here, the one that has pneumonia, there is excess mucus, there is inflammation, an inflamed, thickened bronchial, and that's going to narrow the airways. So, inflammatory disease of the lung parenchyma, we're talking about the bronchioles and the alveolar, marked by increase in interstitial alveolar fluid because now of the fluid and the pus that fills the lung parenchyma. Some of the risk factors: age, that's 60 years and above, history of smoking, those with upper respiratory tract infections, those who have had tracheal intubation. Some conditions require patient to have tracheal intubation. We talked about some in the morning. Prolonged immobility. That's why we talked in the morning that we encourage mobilization. Case of malnutrition, altered consciousness, case of dehydration, chronic diseases can be some of those risk factors. So classification can be classified in different ways according to the causative organism, according to environment, according to the area of the lung affected, or the cause. So according to causative organism, bacteria, pneumococcal pneumonia caused by Streptococcus pneumoniae, Staphylococcus pneumoniae caused by the Staphylococcus pneumoniae still, gram-negative bacterial pneumonia caused by Klebsiella pneumoniae. Basically, that is according to the causative organism. Viral, like those that are caused by rhinovirus, coronavirus, influenza virus, adenovirus, and such. Fungal pneumonia, basically caused by the fungi. Then, according to the environment, we have host-acquired and community-acquired. So, the community-acquired pneumonia, one that is now acquired outside of the hospital or at least less than 48 hours after hospital admission. Most commonly, the most common cause of the community-acquired pneumonia is Streptococcus pneumoniae, which is the most common. Then ventilator-acquired pneumonia, usually for those patients who are on mechanical ventilation or ventilatory assistance. So, and that allows pathogens to get in from aspiration or during the intubation procedure, or contaminated secretions or respiratory equipment. So anything that comes in as a result of that mechanical ventilation. Then you have pneumonia in immunocompromised host, where the person now presents with pneumonia because their immune system or they have a defective immune response. Parasitic pneumonia caused by protozoa and nematodes. According to the area that is affected, we have the lobar pneumonia, segmental, alveolar, interstitial. So it's up to you. According to the cause, eosinophilic pneumonia, chemical pneumonia, aspiration pneumonia, allergic. Basically, that is what caused this pneumonia. So, with your pathophysiology, basically, the infectious agent getting into into the body. Just a minute. They enter the blood circulation or aspiration of gastric content. That's going to cause inflammation of the pulmonary tissue, and that's going to affect both ventilation and diffusion. The alveoli are now going to fill with exudates because of that inflammation. The exudates now will interfere with the diffusion of oxygen and carbon dioxide, and that's going to cause hypoxia. Or with the inflammation now, there'll be mucosal edema, which will cause now occlusion of the alveoli, and that's going to result in decrease in alveolar oxygen tension, and that's going to cause hypoxia. Your clinical manifestations: crackling sound from the affected side, hyposemia, tachypnea, productive cough, a decrease in the breath sounds, and equal chest expansion. All these are of pneumonia. To do your diagnostics, chest x-ray, it will show you consolidation or infiltrates. Because of now the, the inflammatory response and what has happened within the area that is affected. So you'll see basically consolidations. And if you want to do definite diagnosis, you want to know the causative organism, then you can do sputum culture and analysis, serologic testing, and such. So chest X-ray, one of the most commonly used type of diagnostic tool. The pharoptic bronchoscopy, um, which allows the physician to examine the breathing passage of lungs, and this can be used of like a diagnostic procedure, but also can be used to treat existing problems. So it allows you to visualize. Polymerase chain reaction, that is the PCR, where a whole blood sample is taken and analyzed, and it appears to be sensitive and a very specific diagnostic test that will help you to identify the causative microorganism. Complications of pneumonia can lead to emphysema, and that's emphysema or emphysema, collapse of the lung tissue, lung abscess, because of the accumulation of now the exudates and the pus within the lungs, sepsis because of the infection which can get in the bloodstream, bacteremia, again, infection from the uh, infection to the blood, hypotension and shock, atelectasis, pericarditis, acute respiratory disease syndrome, all from just the collapse or non-functioning of the lungs. Prognosis can be managed, more especially if the symptoms are able to be diagnosed or on time. If not, then it can progress and prolong to something different that can eventually require patient to even require intensive care. Your nursing care, history taking, again, very important. Observing the patient, performing respiratory function, that's you look at the rate change, character of respirations, auscultate the lung sounds or the breath sounds. Physical examination, arterial blood gas analysis, which will help to evaluate whether the patient needs oxygen support. Your nursing diagnosis, ineffective airway clearance. Again, of course, you want to manage that by improving the or creating airway patency. So those are your interventions that will help you to create airway patency. The same one that you have been talking about. Hydration, which is going to thicken the, liquefy the secretions. Humidifications, again, can also loosen the secretions. The breathing can help to expectorate the infection, I mean the mucus. Spirometry, again, to monitor the oxygen saturation levels. Ineffective breathing pattern, again, is the same case. Let the patient sit in an upright position. Diaphragmatic breathing for the patient. Rest periods between activities. Ambulating can allow oxygen to flow. Activity intolerance, you want to promote rest and conserve energy. So those are your interventions for activity tolerance. Risk for deficient volume, promote adequate fluid intake. So increase fluid intake for the patient. Uh, Monitor the patient whether they have any pre-existing conditions. So all these are your interventions, your nursing diagnosis and interventions. I don't have to go through each of those. Of course, patient education, very important. Educate the patient to complete the entire course of their treatment, more especially their antibiotics. Um, Chest X-ray, very important. Talking a bit about smoking cessation, advising the patient to do frequent hand washing, more especially if they are coming in contact with others. Activities that regulate or that reduce fatigue should also be encouraged.